All right. It is 5 o'clock on a rainy Sunday. This is the time we come together every single week to talk about where we are in dealing with this worldwide health pandemic and also recommit ourselves to winning. And winning in this instance means getting through it. It means protecting the people around us. It means making sure that this virus doesn't get into places where people are most vulnerable. And it means making smart decisions moving forward as we reopen this economy. But let's start the way we do every single day. It's a small reason because we all believe it, that I believe we are where we are in flattening this curve. And that's by reaffirming that we will get through this and we will get through this together. Say it with me. We will get through this. We will get through this together. One last time. We will get through this. We will get through this together. And we're going to get through this together because every day we remember what it takes to do it. It's the 10 steps to defeating COVID-19. These 10 steps are critically important. We're going to keep talking about them even as we're able to do more things that are out there, because the more this becomes muscle memory, the more it becomes a part of our new normal, because until there's a vaccine, our new normal is going to be different than our old normal. These are going to be absolutely critical. First, healthy at home. Healthy at home means that we are at home unless we're getting exercise, we're going for groceries or supplies, or we're going to work. And even as we're able to open other things, first, more places of business, it's going to look different. A lot of people are still going to be teleworking, meaning being healthy at home. But just because we have healthy at work doesn't mean that every other minute we shouldn't be healthy at home. And even when we can do a little bit more, it's still always going to come back to being healthy at home. Remember, we're working to safely and gradually reopen an economy in the midst of a very contagious and deadly virus during a worldwide health pandemic. So healthy at home isn't going anywhere. Let's make sure we remember it and we stick to it. Avoiding crowds and gatherings of any size, of any type. Just remember how important that is. That's how the virus spreads. Practice social distancing, 6 feet, knowing when to seek care. Our website, more and more important every day, because now as we move into a new phase, there's going to be a lot of nuance. There's going to be a lot of very specifics. Important that we go there. Washing hands and surfaces, applying for benefits. So our unemployment website was down about 2 hours today because of demand. It is back up. And my hope is tomorrow I'm going to announce some really significant good news for folks that are out there and have waited too long. We're working on it last night, today, and tonight, and we believe that it's going to secure some really good results. If you applied in March and you haven't been helped, and the problem is on our side, it's not. There are some instances where there are real issues. Then you need to be helped in April too, and we are working on that. And I hope to have very good news. Prioritizing your mental health, not traveling, and reporting noncompliance. 10 steps that have helped us to flatten this curve. 10 steps we've got to keep practicing as we move into a new normal. 10 steps plus one more. Do your census. Fill this out. It is so important. It is how we have expanded Medicaid and expanded Medicaid. It's the dollars we get for SNAP and other benefits. It's how we help lift people up. And as everybody is working to rebuild and restart their economies, if we do better than other states, we will have a head start based on how we fill out our census. So please do it. We moved up over the last couple of weeks, at least 2 spots. We can do even better. It does not take more than a couple minutes. Please do it. If you haven't done it tonight and you can go online, please go online and do it tonight. One small thing that you can do. Now, in addition to the 10 steps and filling out your census, what we ask you to do is your duty. Your patriotic duty as an American and as a citizen of this Commonwealth. the duty in following these rules and regulations that help us beat this coronavirus. And while I know we're anxious and we've been at it for a long time, look at what you've done. I mean, we look at how we've plateaued in a virus that we were all very concerned would spike, would exceed our healthcare capacity. You've done something that no one that's ever faced something like this has ever done before. So we need you to keep it up, right? It's given that this is a deadly and a difficult disease, you hate to use sports analogies, but if you are doing something and it's helping you to win, it's helping you to continue to build your lead, you don't stop it, right? You continue to work and work and work, and that's what we need you to continue to do. And one of the ways that we encourage that, because it takes everybody, right? Every single person's decisions matter. Every single person can be a hero or shero during this. And so we've asked you to model that behavior on social media. And so here's a little bit of what we got today. All right, this is Joyce, who, like me today, was worshiping remotely, virtually. I want to thank, it's Sunday, I want to thank, and it's Ramadan too, I want to thank all of our faith leaders out there. I got to tell you, I think we have more as a percentage, as an overall number of our houses of worship, worshiping remotely, doing drive-in services, probably than any other place in America. And for that, I'm really, really grateful. We allowed the type of drive-in services that many states don't, but you all really stepped up and shown and lived up to that golden rule as treating our neighbors as ourselves and truly loving your neighbor. And for that, I'm grateful. It's one of the reasons that we have flattened the curve, and it's one of the reasons that I think we will get to our new normal faster than other places. All right. So we talk a lot about our frontline heroes. We talk a lot about those that are directly helping those with COVID-19 and how we need to stay home to help them. What we don't talk about are their families that are worried about them, that they could potentially bring the virus home to themselves. So this is a 3-year-old who is talking about his or her dad. This is Beryl. Pretty special. Remember, all those frontline heroes, we're not just staying healthy at home for them. We're staying healthy at home for their families that are counting on us because they want mom or dad to come home and to come home healthy. All right. Again, one of the many faces on our front line, seeing a little bit of the PPE, seeing how serious what they do is, remembering that we all have a duty to help protect these warriors. All right, again, what we see out there is more unity, more solidarity about defeating this virus, about doing this right, about coming together than ever before. Team Kentucky is a lot bigger than me. It's all about you. It is about us coming together, about the divisions fading away. It is about us not only doing what it takes to flatten the curve, but making smart decisions moving forward so we can protect each other and we can thrive, but doing it together. And again, there are no easy decisions. We're all doing the best we can. None of us have ever lived through this before, but none of you are alone. We're all in this. With each other together. All right. Again, to our everyday essential workers, remember, you are not only appreciated by me or others that come up here. These are the kiddos that are counting on you every single day, and you show up and you make sure that their basic needs are met. All right, so again, what we see all across Kentucky is us honoring those that we've lost, lighting up our facilities, our city signs, green to show compassion, and also renewal. And one of the things that I really love about this isn't just the unity that it's shown, And it is not just that it shows how much we care about each other, but renewal means that we know there is a better and a brighter day coming. And this is just one way we show it. So thank you to Cynthiana. And here's the St. Matthews City Hall. Again, it's all over, everywhere. People coming together doing this, more green lights every single day. Let's keep that up. Again, at a time I was just reading about a family that had lost and how they couldn't be together at that funeral, how they had to stand apart from each other, and how do you do that? I mean, it's not easy, but this is something where we say we care about you and we are there for you. So the next thing we've got is another video, this one from Baptist Health, of someone else who has recovered from COVID-19. And I think this is a physician's assistant. So this is one of our heroes that has been on the front lines that contracted it and now is coming out of it. It's going to be all right. Oh my goodness. Yeah. So every day we have to talk about those we've lost, but how about those that have come out of it? And that is just incredible. Everybody out there that has helped that individual and so many others recover, and everybody out there that has had to go through this and fight through this, and to everybody's family that has worried. These are great outcomes, and these are great stories every single time. And I will tell you, I'm going to show as many of them to you as we get. We got to celebrate those recoveries. All right, so what we also do each and every day is we learn a little bit of new sign language, and we have Rachel with us here today. This is just a chance, as we have been reminded through this, that we have to be kind and compassionate to one another, that part of that means including and being kind and compassionate to everyone. So today we are going to learn, thank you for your sacrifice. Thank you for your sacrifice. Oh, got it. All right. Thank you for your sacrifice. Let's do it one more time. Thank you for your sacrifice. Thank you, Rachel. All right, going to do some updates tonight. I will say we're going to have a very busy day tomorrow. We're going to lay out a lot tomorrow, which I'll talk about in a minute. But I want to start tonight with, again, reminding people of the numerous testing options that are available this next week. This next week, we will have more testing statewide than we have had in any week thus far. We're going to have 11 locations. And I will tell you that people are responding to this in really incredible ways. So Louisville and Lexington are running, Louisville and Lexington have multiple locations. Two of them are our Kroger partnership that the state's working with Kroger with, and those are actually booked full Monday through Friday. Bowling Green is also that Kroger partnership. That booked up for the first 3 days it was going to do so fast that we added Friday of next week. And if it is not booked up from yesterday, you can still sign up for it. We're going to do another week of that. For those 3 locations on the Kroger signups, the second week isn't available for sign up yet. It'll be next Wednesday before that's possible. For those 3 locations, for 2 of those locations, we also have separate partnerships. We have a Walmart partnership in Louisville at Bashford Manor outside of the Newburgh area. And here's how you sign up for that. Again, it's a little bit different. It's eligible for first responders, healthcare workers, and anyone over 18 that has symptoms. If you can go back to the last slide. Lexington, the second testing site is with Walgreens. And if you could bring that one up. Unlike the Kroger site, isn't open to everyone. That is, again, limited to certain first responders and those that have symptoms. It doesn't come up here in a second. All of the signups are on our website. Again, this just gives you some of the information. And folks, we hope that each week our number of testing sites will increase. And it's going to make kycovid19.ky.gov even more important, because I know you're not going to catch it all while you're here. If you go back to the last slide that has all the locations, we also have Owensboro going Tuesday through Thursday in the Kroger partnership. Katie's is going through Trigg County Primary Care, Hazard through their primary care center. There, Hopkinsville, we're working directly with their health department. And again, Mount Vernon, Murray through their hospital, and all of these aren't limited just to their counties. So if you live close and there are still ways to sign up, please do. Many of these accept anyone and everyone. And we want to make sure that we take advantage of this. Let's have more tests in Kentucky this next week than we have seen in any single week. And we've got the chance to not quite double the number of people that have been tested, but do a significant amount. This is next week. I think we'll have more information as the week goes forward about additional testing sites. This is us ramping up capacity so that we can reach a new normal where we've got to have, we'd like to have at least 24,000 tests a week, if not significantly more. This helps us with other areas that are working to hopefully get to about 20,000. All right, so next we're going to spend some time with Dr. Stack talking once again about the healthcare reopening that starts tomorrow. So tomorrow is the first day since this virus hit that, as opposed to adding restrictions, we are reopening some areas. And we're starting with healthcare for some very simple reasons. First, people have not been able to go in to some types of visits and important appointments to keep themselves healthy. And people can grow unhealthy or have issues that are unrelated to COVID-19. Second, we need to get our healthcare industry moving again, because as we want to test more people, we will need our healthcare industry to be operating at a greater level to make that happen. And third, in thinking about how to do this gradually, in a way that protects people, in a way that we can always take a temperature as we move forward, healthcare is the place to start, because it's the people who are best trained at dealing with potential contagion. So instead of opening it up in areas that have never had to deal with, will my services potentially spread the coronavirus, we're starting in healthcare where people can be very cognizant of what they can do to stop it. So Dr. Stack's going to basically talk about what's happening tomorrow. And then tomorrow on Monday, I think we're going to lay out a bigger schedule with dates on the phases that we see for healthcare moving forward. And tomorrow, I think I'm going to talk a little bit about where and when I see a potential broader phase 1 reopening in Kentucky. So, Dr. Stack.
Thank you very much, Governor. Good evening, everyone. The governor's going to give me a few minutes here tonight to kind of go over this. I realize this is a big step. This is the first time of significance that we're removing any restrictions. A few disclaimers. You'll remember when we started shutting things down, how difficult that was. We were giving instructions that were entirely unfamiliar to all of us. We were changing the way society operated. The pace that we had to do it was brisk. And we asked everyone's indulgence, everyone's patience and tolerance as we worked together to try to keep everyone safe. We are now about to begin unwinding that. I would say that as hard as it was to say no to so many things, it'll be challenging to say yes but to a lot more things as we start to try to relax restrictions, but to do it in ways that are safe, or at least as safe as we can make them for society. A few other thoughts before I go into these slides again real quickly. I ask you to keep in mind, from a public health standpoint, from a medical standpoint, we would probably prefer to wait even longer before lifting any restrictions. But we're trying to balance competing societal needs, people's need to get back to work, people's need to perform other important functions in society, people's need to pursue their lives, with the need to also keep people safe. So as we work through this, I ask everyone's patience and everyone's tolerance as we continue to work together as Team Kentucky to get through this together and to get through it better. So I'm going to use the slide deck that I used last week. Now in this, there's a challenge in creating in just 5 slides something this complex. So there are obviously limitations to the slides, but I haven't changed them intentionally because I want them to be consistent over time, and we're going to walk through them now one more time for what this means. Starting tomorrow, we're going to begin what I would call phase 1 for healthcare reopening. Now, in anything I say here, and I direct this at the healthcare community specifically, and by healthcare I mean any kind of healthcare, and that includes dentistry as well, and every other kind of healthcare, whether you're chiropractic or dentistry or any. I've learned there are a lot of different types of healthcare out there, and if I don't call out specific names, people often don't hear that it's relevant to them. If you are not ready to do the things we say the way they have to be done, you are not required to open tomorrow. Please don't open. I realize that the rules, the new executive order will come out tomorrow sometime, probably not until the afternoon, that describes a little more detail about what's required. I realize that I announced this last week and that now here we are the night before some things can start reopening, and it is difficult. We've got the things kind of backwards a little bit. At the pace we're moving and responding to competing societal demands, that is an unfortunate reality of the challenge we face. We'll continue to try to do better, continue to try to get things in the right sequence, but I assure you that as we go forward, there are going to be times when the guidance is not as clear as any of us would like, where we have circumstances where we need to clean up or clarify inconsistencies on the website or in previous executive orders, and we commit to you to do that as quickly and efficiently as we can. So real quickly, I won't spend as long as I did the first time I used these slides because they're not as foreign to the audience who needs to hear them, and they're on the website already posted. So you can find this on Phase 1 Healthcare Reopening right on the KY COVID-19 website. So starting tomorrow, non-urgent, non-emergent healthcare services and diagnostic laboratory and diagnostic radiology studies can resume in the outpatient setting. Now, here is one of the things that I was perhaps imprecise on the slide deck, but everything subsequent to this has been very clear. This does not include elective surgery or elective invasive procedures. So surgeries and invasive procedures are not included in Phase 1. That will be a later phase. But allowing for that, healthcare clinics, medical clinics, chiropractic, medical offices, physical therapy, optometrists, all can open tomorrow. And I'm going to talk specifically about dentists on the 5th slide because there's been a lot of complexity there, and I'll tell you, the dentists have really reached out in large numbers. And so one, thank you for your input, but two, it also clearly represents a challenge, and I'll try to be more clear on the 5th slide. This does not apply to things like long-term care settings or prisons. There'll be separate guidance for that. Kenneth, if we could do the next one. So it's a phased, gradual reopening of services. In all phases, We want people to continue to maximize telehealth. Hopefully, when we emerge from this, telehealth is going to have a new and much larger role in our lives, and I think that's good for a lot of reasons. If there's one good thing for healthcare, hopefully it's telehealth will be bigger at the end of COVID-19. No visitors allowed except for end-of-life circumstances. The same general restrictions still apply for hospitals and confined populations like prisons and nursing homes. Traditional waiting in common areas are expected to be eliminated, and use things like the parking lot as a waiting room, or sit in your car and text to come in. And where there are times where we cannot entirely eliminate waiting, strict social distancing more than 6 feet is going to be required. You have to schedule for it, plan for it, remove seats to allow for it, make sure the physical environment facilitates and enables that to happen. You also have to maintain the more than 6 feet in all these settings. Next slide, Kenneth. You're going to have to screen all the healthcare workers and people entering the facility. Now, there are two different ways to do this. In the higher risk settings, we would prefer you do temperature screening and infection screening before you permit entry. So ask people, do you have a fever? Do you have signs or symptoms of infection? In the highest risk areas, you should probably just check their temperature at that location. We'll try to give more guidance on that specifically. As we go on and we talk about other parts of society, we may have other ways people can comply with some parts of this in other settings. You have to plan for and ensure enhanced sanitizing processes for your surfaces. Persistent hand hygiene has to continue. The washing your hands for 20 seconds with soap and water and using hand sanitizer. You have to make sure there's hand sanitizer available throughout the facility for people to use. And this is important. We have tried to build up some reserves for PPE for COVID-19 related emergency relief. It is not intended to support regular daily normal operations. So as we say that we will lift some restrictions and people can resume some types of routine health care, you have to be able to get PPE through the normal supply chains, because the emergency system was never designed to be the fulfillment system for everybody's daily routine needs for PPE. So that we'll discuss more later. Kenneth? Thank you. Everybody in these healthcare settings will have to wear masks. So the healthcare professionals and staff and workers will have to wear surgical or procedural masks. The hospitals and the healthcare facilities will have to come up with guidance specific to the setting for what patients and any allowed visitors, which will be very limited, right? Just to support people who need assistance, like an underage minor, or perhaps someone with infirmities who requires someone to help them. They'll have to at least have cloth-based coverings. In some areas, they may have to also have a procedural mask, but we can work with the facilities on the guidance there. Next slide, Kenneth. And now I talked about, this is the last slide, 2 specific circumstances where there are perhaps some additional variations. If you are in what I labeled as a high-touch area, like chiropractic, physical therapy, maybe massage therapy, things like that, the expectation of wearing gloves by the person directly manipulating the patient, single use for that patient, discarded between patients, and still doing hand sanitization, like washing with soap and water between patients, and hand sanitizer. We will continue to work on that, and we may perhaps have special guidance to give to that community in the interest of clarity. The second special area is areas where you aerosolize secretions. That's the most prominent way for spreading the coronavirus. And dentistry was one of the ones that clearly came up. I will say I have received today a very well thought out proposal from the Kentucky Dental Association and a number of other partners who I just don't have time to list everybody. This is a very thoughtful proposal, and we will use this in coming up with the more detailed requirements or rules. I will tell you, for those of you who are seeking to resume dental practice, oral surgery, orthodontics, things of that nature, I suspect right after this press conference, these people are going to post this document, because I just said it's very well done. You should use this as a starting place to guide your preparations. Now remember, I said this already, just because you can open tomorrow doesn't mean you should, unless you are able to comply with all of the requirements in here. So I would encourage you to look at this document. I thank those who put it together, and use this as a way to try to guide what you're preparing for. I want to thank everybody and the governor. We're going to work through this, and like he says, we'll get through this together. I also continue to ask for and thank you for your patience and your tolerance. This is obviously a very complicated undertaking, and though history could tell us we had to shut things down to keep people safe, history is not a very good guide for rebooting a modern-day healthcare system that has been shut down in a way it's never been shut down before in any of our living memories. So we will do our best to work with everyone to do this as safely as possible for all involved. Thank you, Governor.
I want to highlight one of the things that Dr. Stack just mentioned, and it's that when we have phased reopenings, you have to meet the guidelines. And it doesn't matter if somebody else in your industry can meet them and you can't. If you can't meet the guidelines, you can't reopen. I think I mentioned the other day that I got a question that says, well, it says to reopen, we have to have PPE, and if I can't get it, can I still reopen? And the answer is no. I mean, this is the challenge in a worldwide health pandemic, that to do these things, the private sector is going to have to be able to meet higher standards to make sure that we can do this safely. Again, it's a contagious, deadly disease where the mortality rate is significantly higher than the flu. And for those that out there that have been saying that, the flu is about 0.1%. And while we don't have all the data, we'll eventually want to establish it. Right now in the United States, at least for cases that we know of, COVID-19 is about 5.6%. So a huge difference. Now, Kentucky is below that rate. We want to get a lot further below it. He also said something that is transparent and is candid, which is what we've tried to be the entire time. None of us have ever dealt with something like this. None of us have ever dealt with a 100-year pandemic like the Spanish flu. And while history shows us, when we look at all those graphs of Philadelphia versus St. Louis, you don't need to pull them up, that what is so important is, number one, that you cut contacts and you shut things down for a period of time, and number two, that you have to have the right timing to reopen them. None of us have ever had to reopen an economy during a worldwide pandemic before. And so we're going to do the best we can. And sometimes some of our decisions aren't going to even be fully consistent with others. You know, we're trying to deal with a whole lot of specific industries, some of which we won't even know that well. But what we're trying to do is to do it safely. And so what we're going to have is a lot of dialogue with folks out there, and we're going to do the absolute best we can, but it's always going to come down to public safety. And so, again, I've never done this before. No governor alive has ever done this before. But I'm going to make the very best decisions I can, treating your family like they are my family, understanding, and I hope you understand how much I care about each and every person in this Commonwealth. We're going to do this in a gradual, measured way. Again, we don't have to be the fastest. I mean, the fastest is the canary in the coal mine, and we're happy to watch what happens there. Ours is to do it the smartest and to make sure that we're protecting our citizens. Also, just want to show you again a mask. This is one of the masks we're going to be handing out in Louisville and in Lexington. It's actually created by our folks in the correction system, and after Dr. Stack got to look at these, is actually pretty impressed with what they are. For everybody out there, over the next week, you probably ought to get a cloth mask of some type. As we are able to do more and reopen more, it increases the number of contacts that people are going to have. And so the requirements and the suggestions on masks are just going to increase as we are able to do more. And what we've seen in some other countries when they've been able to start opening it up is it's really important. You know, when we're all healthy at home, we didn't talk about masks as much because if you're limiting those contacts, we don't want to create kind of an excuse to where you might feel more comfortable doing it. But if we have more people going back to work or being in congregate settings, it's going to become more and more and more important. So again, tomorrow we'll talk about phases and dates on other parts of healthcare, and I'm going to talk specifically about the when I see phase one and a little bit of what we hope will be in there. Again, it's going to be a fluid situation. All right, our numbers today. Again, all in all, are better than what we've seen in some days. Now, our total number of new cases is certainly higher than yesterday, but a lot lower than when we had the 320 something. So we have 202 new cases of the coronavirus. Now we have those 202 with expanded testing, but it tells you that it is still out there and it's still spreading. But all in all, I still believe that we have plateaued, and this number conforms with that conclusion. When we remove duplicates and otherwise audit our numbers, which we do every day, our total official state number for cases is 4,074, 4074. Again, we expected this and more cases. Remember, there are asymptomatic people out there, but as we increase our testing, we are going to see more cases, and it's going to help us to respond better. Our total number of people tested is at least 48,474. Number of people ever hospitalized, at least 1,274. Currently hospitalized, 308. Ever in the ICU, 608. Number of people currently in the ICU, 166. That's up a couple from the last couple days. So again, let's remember every day we need to think about, pray for, and send our best wishes to those folks that are fighting for their health. Number of people recovered, 1,511. And you know what? I want to see the video again. This is one of those that is special. And if I can, I'm going to give you a little bit of extra detail on it, because in this one, we have it. So this video, when it comes up, is Sheila Thornsberry, a COVID-19 patient who was discharged from Baptist Health Lexington last night. The 50-year-old physician assistant had been admitted on April 2nd. And I apologize, they put your age down here, and I should not have read it. My mom taught me better than that. Surrounded by her care team, with staff applauding, the Lexington mother of two exited the hospital to the strains of a song picked by her for this occasion, Stand By You by Rachel Platten. The ICU staff became her friends, family, and the source of socialization. This is her. She said, "They did their absolute best. I couldn't have asked for better care." As a patient, Thornsberry has learned of the toll of COVID-19 and what it can do to the body and the pain it can bring. Listen, this is important. She hopes that everyone keeps self-distancing, washes their hands, wears masks for their own safety and the safety of those around them. So somebody who has been through it and was fortunate to come out on the other side. Now, not everybody comes out on the other side. And so we've got to think every single day about those we've lost. Today we have the lowest death toll that we have had in a while. And for that, I'm really grateful. But we still have 3 individuals tonight that we have lost to COVID-19. And while it is a smaller number, they are people that are truly missed by their friends, by their family, and let's make sure that we give them just as much effort tonight, lighting our homes up green and our places of business. Let's make sure that we ring bells tomorrow at 10 a.m. These are 3 Kentuckians we've lost, and we need to make sure that we are showing that color of compassion and that we are there for those families that can't be together in the same way during this. So our deaths tonight are an 88-year-old female from Adair County, an 88-year-old female from Jackson County, and another 88-year-old from Adair as well. So again, they are more than ages and locations. They're people that we are going to miss. New cases by county start tonight with Warren County with 35 new cases. It's one of the reasons after Judge Buchanan asked us that we opened up this week an extra day and that we've committed to an extra full week in Warren County. They're being hit by a lot of new cases. We want to be there for them, to Bowling Green, to Warren County, and to the entire community. We care about you. We are with you. We're going to help you get through this, and we're going to get through it together. 28 additional in Jefferson, 19 in Grayson County, 14 in Muhlenberg, 11 in Boone, 10 in Hopkins, 9 in McCracken, 7 in Davis. We're going to be there on Tuesday through Thursday testing. 6 in Campbell, 5 in Graves, 4 in Floyd and Marshall, 3 in Adair, Callaway, and Fayette, 2 in Ballard, Butler, Edmondson, Jackson, Kenton, Madison, and Nelson, and 1 in Anderson, Breckenridge, Cumberland, Franklin, Fulton, Hardin, Henry, Jessamine, Johnson, Letcher, Marion, McLean, Meade, Monroe, Oldham, Pike, Pulaski, Scott, Simpson, Todd, Trimble, Webster, and Whitley, with 4 unconfirmed. Again, what that tells us is it is everywhere. I'm sorry I was doing that really fast. But it is everywhere. And while we could put up a map and there might be 9 counties, maybe we're 8 counties left that you would see as not having a case, there is a case there. So as we move forward, as we try to make wise decisions to ease restrictions at a time where this pandemic is still very dangerous, understand that we've got to make them as a state, or if we get to a point, regionally, and not a county-by-county basis, that we want to include all those voices out there of our local leaders and others. Race and ethnicity. The update today is of all cases, 75.44% white, 13.53% Black or African American, 6% Asian, 4.87% multiracial, and the ethnicity is 91.5% non-Hispanic and 8.5% Hispanic. Of deaths, of where we know the deaths, which is 85% of all cases, 80% white, 16.85% Black or African American, 1.69% Asian, 1.12% multiracial, and where it comes down to ethnicity, it's basically 99% non-Hispanic and 1% Hispanic. Really quickly, going over a couple areas that we try to update on each and every night. First of all, let's go to Green River Correctional Complex. The first time in many days, it's the same. That we don't have new cases to report from that complex. We are working really hard there. Yes, it is a bad situation. And yes, those that are talking about being afraid, I understand. But it's a good day when there are no additional cases, and we continue to take more and more steps. I've committed to testing every single person that is an inmate that works there on a regular basis or comes into any contact whatsoever. Our long-term care facilities. While it's hard to describe something as a new day, as a good day, we have the fewest additional cases in long-term care facilities than we've had in a number of days. Part of that is reporting, and some of the labs not reporting in on Sunday, but we have 8 new residents, 7 new staff, and 1 new death. Remember, as we make these new decisions, as we try to ease restrictions, we got to make sure that we don't increase the exposure. Listen, this is what's happened in these facilities when we've had everything shut down. And this is what's happened. This is this virus and what it does to a certain population, even when we flatten the curve. So we got to be really careful when we start expanding our opportunities that we're not allowing it additional access to these facilities. All right, we're going to open it up for questions. Today we've got Philip Bailey, Karen Czar, and Shelby Smithson from WKYT, and I've got just a couple of questions that have been sent in. So, Shelby?
So there's been some question as to why we're moving into the phase 1 reopening tomorrow before we hit the benchmarks, like the 14-day decreasing. So can you clarify why I think we're ready tomorrow?
So the question is why we're moving into phase 1 before we've hit the 14-day benchmark. We're not moving into the phase 1 as described by the White House. It's the White House directly that gives us that 14-day benchmark, where we just want to see a decrease in the new rate of cases. It doesn't have to be the overall number, but what we want to see is a rate of overall cases, and generally looking at everything that we believe we're on the decline. what we are starting tomorrow is a phase one in healthcare and healthcare alone. And it's a couple of reasons. Number one, we got people coming in sicker to our ERs than they have been in a while. It's that there are services that people need for their overall health in addition to COVID-19. Number two, we've got to increase our testing capacity, ultimately to reopen other parts of our economy in the state. And we need more of our healthcare field active. I mean, when we look at antibody tests, which we want to eventually do, and different types of blood tests, where are those going to be done? They're going to be done in a lot of the facilities that have otherwise been closed in healthcare. But the number three part, and when this was suggested to me by Dr. Stack, that I was very interested in, is this is a more controlled environment to start and to learn from. Those in our healthcare industry have better access to PPE, which is important. They are trained to better protect themselves from the spread of the virus, and they give us an opportunity to both have a model in how we do it, but to also gauge very early in how well we're doing it, and to learn for types of industries that have never had to do this, the types of lessons that we need. So when we look at a gradual, phased-in approach, healthcare is the logical place for us to start. All right. On the 14-day benchmark, there seemed to have been the impression that cases means the number of new cases reported every day, but it could also mean the total number of cases reported to date minus the total number recovered. It's really the rate of new cases. It's about whether for the amount of people we're testing, we see the disease spreading faster or spreading slower. And so it's a little bit of a science and it's a little bit of an art. It's taking all those numbers in with Dr. Stack looking at it. But again, it's not that we have 200 one day and 160 the next, 140 the next, and 100 the day after that. It's going to go up and down. And on a day where we have 6,000 tests come in, which we had before, it's going to vary. So it's an overall decline. And the second piece is, what is the current criteria for nursing homes to be able to have access to increased COVID-19 testing, and about sentinel surveillance, and a couple other pieces. So nursing homes have become stratified into red, yellow, and green categories based on several factors. We'll test those in the red category first. As testing becomes more and more available, we learn the best way to support facilities through this process. It will expand even more. Testing is only one element of a complicated array of issues that nursing homes must address in responding to COVID-19. For a nursing home to access testing provided by the Commonwealth, it's got to be working with our Department of Public Health. It's got to collaborate on its established process on how it deals with potential infection and its response, and it's got to comply with a facility plan we put out there of best practices. Right now, we're working with a number of these facilities to advise on testing, infection control, appropriate PPE use, PPE conservation strategies, how you make it last, staffing considerations, crisis stabilization, resident staff cohorting based on COVID-19 status, resident transfers to long-term acute hospitals, and now we have a long-term task force as well to deal with this. So as you can see, we are putting a lot of time and resources into this, and I believe we're doing all the right things with all the information we have. But I don't want to sugarcoat it. I mean, the coronavirus is deadly in these settings. It's why we cut all visitors at a time when people maybe didn't understand why we're doing it. And so this is a setting where it's a matter of life and death, and we're doing the best we can in a very difficult circumstance with a virus that comes for those that are already vulnerable. Phil.
Governor, as far as the phase one openings, what are you prepared to do if businesses don't follow all the rules, and how do people report any violations by businesses?
So the question is, with a phase one opening, when we hit it with a larger group of businesses, and I'm going to talk about timing on that tomorrow, if they are not meeting the guidelines, what are we going to do? Well, the guidelines aren't just guidelines, they're going to be requirements. So in other words, if you are a type of a business that is opening up, and obviously you need some level of protection, whether it's masks or if you have more interaction with the public, maybe more, and you can't meet those requirements, you can't open. Our hotline for noncompliance is going to be available and active at that point. Our labor cabinet and others will be enforcing it. This is one of those where we want businesses, if they're safe, to be able to open on a gradual timeline. But if they can't open in a safe manner, they just can't open. And that might not seem fair, but it's not fair if we open in an unsafe way that spreads this coronavirus. So there's going to be a real enforcement piece. But I will tell you that every group we've worked with, every business group, every call I've been on in the chamber, they all understand that, and they want this to be done safely because they don't want that second spike. If we can open safely and prevent a second spike, then our economy will not only open but stay open. If there's a second spike, it closes back down again. And none of us want that because it does more long-term damage, and that's every economist and every health professional that agree. Are the testing sites for next week open to folks in the host county as well as contiguous counties? Yes, and you can even be a county further away than that. Please take advantage of it. Will the second week of testing in Bowling Green run Monday through Friday? I believe that answer is yes. And we at least extended, it's at least Tuesday through Friday. I'll need to check if the second week of Bowling Green is Monday through Friday. But you'll be able to sign up for the second week of Louisville and Lexington and Bowling Green coming up this Wednesday. You've talked more about masks in public in the months ahead. If a great many people do wear masks this summer, could it help prevent a surge this summer, even in the fall? I think that answer is yes. It doesn't mean that it won't happen, but anything that you're wearing, if you think about yourself being asymptomatic, I haven't talked about it in a while, but remember, we have two duties. One is to try to prevent yourself and your family from getting the coronavirus, but the other is to prevent it from spreading it to other people. So if you're wearing something like this, you are preventing, in many instances, your ability, at least through one method, from being able to spread it to somebody else. So do I believe that as we open up and do more things, that masks will be incredibly important to determine whether or not there will be a next spike? Yes, it's not the only factor, but it will be a factor. Karen.
I've had several massage therapists who work either alongside chiropractors or physical therapists asking if they can follow all the guidelines, would they be able to open alongside their practitioner?
I think massage therapists will be another step that is going to become that's going to come later. I think it was very specific to the healthcare industry. I'm looking at Dr. Stack just to confirm. Okay, we'll have more information on that, but we don't have specific guidance right now for our massage therapists, and we'll need to have that in place before we open up and start. Now, with that said, given that they are similar, we'll be looking at those guidelines, and hopefully they will be able to follow soon thereafter. But this is one of those things where I know they're probably saying, but what we do is pretty similar, and what we do is connected to it. Well, part of it is we also need the time to make sure things are safe. So if their association hasn't already, if they can submit by our website, that's the Healthy at Work website, we'll start taking a look at that. But tomorrow, I'm going to be talking about, I'm hoping that we will get a lot of phase one as we talk about on the national scene, but with Kentucky centric requirements. I'm hoping we'll get a lot of that done in May, and we'll talk about some of those dates tomorrow that would include that profession. Let's see. Okay. Phil?
Yes, the national government, I'm sorry, actually.
Yeah, Shelby. I missed that.
It's okay. So we've had some reports from businesses that say they were wrongly cited, and so now as we're reopening places back up, can you explain the process of after you get a complaint on a business, are they automatically cited, or is there some sort of process into researching the validity of them?
The question is, what happens when there is a call, and how does the business eventually get cited? So what happens is a call comes in, and a labor cabinet or other government inspector goes out, views the premises, and does that research, and a citation normally comes out after that. Now, there are different circumstances at different times, and you can have evidence in different ways. I believe that the labor cabinet has worked with businesses in most of those instances, but especially at a time where we are right now. There's sometimes you got to make a quick decision to say, whoa, let's pause, and you tell us everything that you are doing so that we can determine that it's safe for the public. And that may take a swifter action in the initial term than it would in other instances. But when you're dealing with something like this, that's just what we've got to do. But it is important, and we're going to talk about it, that businesses right now and healthcare, they've already put up some of the things, but we've talked about some requirements of, every business when we're able to open in phase one is going to have to be temperature checking their employees. So you need to go out and get that equipment now. And so if the answer is, what if I'm unable to do that, then it's not safe. Masks, and not surgical masks, not N95s, please, not N95s. Those are going to be important. And the question is, if I can't get those, what can I do? I mean, again, it's got to be safe in each and every one. And the challenge here is that with us trying to stockpile for a potential surge, it's going to need to be a private business is going to have to be able to secure the resources, the things they need to safely reopen too. And while that's hard, trying to reopen in the midst of a pandemic is hard. Phil.
The National Government Association has asked Congress for, I believe, $500 billion in federal aid for states to help stabilize their budgets. How much do you think Kentucky needs, and when do you hope to speak to Senator Mitch McConnell about that relief plan?
Question is, the NGA, the National Governors Association, has asked for something around $500 billion for state budget relief around the country. In reality, the federal government's going to need to do more than that, because local, county, and other governments, if we cannot ultimately sustain or have budget relief, it is going to significantly worsen the recession we're facing. In 2008, 2009, faced with simply a recession, and at the time it was a big recession. It was a big deal to all of us, but it wasn't a worldwide health pandemic. The federal government provided relief. It's got to do so now. I have not had, since the bankruptcy comments, I've not had a personal conversation with Senator McConnell. I need to. And listen, every day I do questions, and I know he's answering questions every day. I hope that he was making a point about something and ultimately supports this. I'll certainly ask him to support it, and if he can lead an effort to provide that stabilization, it'll help Kentucky. At the end of the day, if he can help us come through and do that, he will help Kentucky's economy get rolling faster and lessen the recession that we're going to see here. And I hope he's responsive to that. And he's been good to work with through this coronavirus, and he's taken my calls when we've talked, and I've taken his. Karen.
Kind of piggybacking on Shelby and to the citations. It's been 2 weeks since, I want to say it was 18 or 19 businesses and organizations citations went out asking people to quarantine. Do we know if people followed those quarantines? And moving forward, this is probably going to become more of an issue as more things open. What is the plan is it a please do it plan, or will it be something deeper?
So that's a really good question. As we move to reopen, we're going to have robust testing, which we're working on. And then when someone tests positive, that person is going to have to self-quarantine, as are certain people as we do contact tracing around them. And so it's a new normal where people are going to get a call and say, you've been exposed to somebody, you can't show up for work tomorrow even though your work is now reopened. You got to quarantine for a certain period of time. I don't want to say 14 days because the guidance is changing on that. And as we have more testing, maybe new types of testing will help on that. But we've all got to expect that will happen. Enforcement is going to actually pick up in different ways outside of traditional government enforcement when we do that, because a business is also going to be very responsible for if they have someone that tests or they have individuals there that are part of those trace contacts. They can't come back in the facility. It compromises the entire group. So in many ways, we're going to bring in a lot of other people to help us do this safely. And it's going to be in all of our self-interest to make sure that that happens. We'll do one more set, Shelby. All right, Phil. All right, Karen. All right. We got this done in about an hour today. Let me end by telling you how I feel today. And I will tell you, I feel hopeful. I feel hopeful because we are at a better place today, a far better place than anything, any model, any expectations that I was ever given. I struggled in those early couple of weeks about the type of devastation that everybody was telling us that we could have. And where we are today makes me hopeful that at a date and time where we probably thought we would see our worst, while we are still dealing with difficulty, your work has saved countless, thousands upon thousands of lives, and for that I am really grateful. I would have thought that I would have been standing here in a different place. And I'm hopeful about moving forward, that if we are thoughtful, if we are patient, and we plan, that we can do this. But we need you to stick with us, and we need you to stay strong. You know, I can see the light at the end of the tunnel. With all the data, with everything else, I can see it. But we got to walk towards it, and we can't rush it. And we got to know that lives are on the line, and this is a significantly higher mortality rate than the flu. So let's do this. Let's do this right. And let's come out of this knowing that we did everything we could to protect people around us, while ultimately reopening in a responsible way. So tune in tomorrow. We're going to have a whole lot of information on healthcare, on when we hope we can see more of phase 1 in Kentucky. Remember, we're in this, and we're in this together. And KET put together something that really highlights that, and that's what we're going to end you with. Thank you.
Kentucky. We're champions and trailblazers, leaders and legends, born to run and celebrate the win. For a state built on spirit and spirits, friends and families, it feels unnatural not to be together, not to be in motion. But these vacant streets and empty stadiums are not signs of our retreat, but of our resolve. This is not us sitting out of the race. This is us winning it. We don't shy away from the challenge. We will forever stand united, even when we're apart. So don't count the days. Make the days count as we take care of ourselves and those we love. Although we pause for the greater good, we know we're coming back with an unwavering tenacity.